First, normal range of post-lunch blood sugar is 150 to 200 mg per dl. Answer is B. Inflammation of dermal and subcutaneous tissue is cellulitis. Answer is B. The normal range of CPK, creatinine phosphokinase, is 0 to 13 sigma unit per ml. Next, Helicobacterium pylori is responsible to cause peptic ulcer. Answer is C. The causative organism of SARS is coronavirus. Answer is B. Next, the most common complication of external cardiac massage is fracture of ribs. Answer is B. Which of the following best describe hydronephrosis? Answer is dilation of the renal pelvis. Next, normal value of total bilirubin in blood 50 to 250 mg per 100 ml. Answer is B. Next, the process by which glycogen is converted into glucose in liver is glycogenolysis. Answer is B. Next, dash dash is one of the treatments for myasthenia gravis. Answer is proteolactic enzyme. Next, multi-drugs therapy is used in the treatment of leprosy. Answer is A. Enlargement of thyroid gland known as goiter. Answer is B. Next, ERCP, endoscopic retrograde cholangiopancreatotherapy, is done to visualize location of stone in the gallbladder. Answer is C. Dead bone tissue is called as sequestra. Answer is B. Next, collection of pus in pleural cavity is known as emphyema. Answer is B. Next, ascites is collection of fluid in the peritoneal cavity. Answer is A. Next, night blindness in caused by deficiency of vitamin A. Answer is B. Next, normal range of blood urea is 60 to 110 mg per dl. Answer is C. Next, dash dash is one of the treatment for myasthenia gravis. Answer is A. Next, dash dash is used as an antidote in tick-20 poisonings. Answer is injection PAM. Answer is C. Next, Helicobacterium pylori is responsible to cause peptic ulcer. Answer is C. Next, pernicious anemia is caused by vitamin B12 deficiency. Answer is D. Enlargement of thyroid gland is known as goiter. Answer is A. Next, bleeding from the nose is epistaxis. Answer is B. Next, osteomalacia is caused by the deficiency of vitamin D. Answer is B. Next, endoscopy is done in esophageal disorder. Answer is B. Bleeding from nose is called as epistaxis. Answer is B. Next, ascites is collection of fluid in the peritoneal cavity. Answer is D. Pernicious anemia is caused by vitamin B12 deficiency. Answer is D. Next, multi-drug therapy is used in the treatment of tuberculosis. Answer is A. Next, injection sodium pentothal is used for anesthesia. Answer is B. Next, ascites is collection of fluid in the peritoneal cavity. Answer is C. Asthma is a allergic disorder. Answer is A. Next, checking of the pulse is an example. Objective assessment. Answer is B. increase blood glucose level, hyperglycemia. Answer is B. Next, enlargement of thyroid gland is known as goiter. Answer is 3. Glasgow Coma Scale is used in unconscious patient. Answer is 2. In diabetes mellitus, excessive thrust is called polydipsia. Answer is 2. Next, pneumothorax means retention of air. Next, in gut, uric acid level is increased in blood. Answer is 2. Next, bleeding from vomiting is called as hematemesis. Answer is A. Collection of pus in pleural cavity is known as emphysema. Answer is B. Multi-drug therapy is used in the treatment of tuberculosis. Next, normal value of total bilirubin in blood is 0.4 to 6 mg 100 per ml. Answer is B. Next, hypertension is called silent killer. Answer is C. Next, endoscopy is done in esophageal disease. Next, ascites is collection of fluid in the peritoneal cavity. Answer is D. Next, osteomalacia is caused by the deficiency of vitamin D. Answer is B. Next, dash dash is one of the treatment of myasthenia gravis. Plasma pheresis. Answer is A. Next, normal level of calcium in our blood is 7.5 to 10.5 mg per dl. Answer is B. Next, ascites is collection of fluid in the peritoneal cavity. Answer is D. Wims Silverman's needle used for lung biopsy. Answer is B. Next, night blindness is caused by deficiency of vitamin A. Answer is A. Next, Ramstad's operation is done in the cause of pyloric stenosis. Answer is A. Next, moon face, buffalo hump and obesity are the cardinal symptoms of Cushing's syndrome. Answer is B. Next, the first step of nursing process is assessment. Answer is A. Osteomalacia is caused by the deficiency of vitamin D. Answer is B. Next, difficulty in swallowing in turn as dysphagia. Next, dash dash is one of the treatment for myasthenia gravis. Plasmapheresis. Answer is B. Next, dash dash is used as an antioxidant in TIC20 poisoning. Injection PAM. Answer is C.